Uh, may every Mm. So, welcome to the Transforming Lives Panel podcast. I'm one of your hosts, Charmin, and Mitzi is here with us, and we have a guest. But before we continue, just join me in taking a few deep breaths so that we can be centered and grounded for the next 4 to 5 minutes. We'll be in unison. So, take a deep breath in through your nose and out through your mouth. And let's repeat that a few times. In through your nose, out through your mouth. In through your nose, and out through your mouth. And as you do that again, and you take that deep breath in, just pay attention to the breath. You have the opportunity to take a deep breath on your own without assistance, and just be grateful for that. And take another deep breath in, and as you exhale, let go of all the stress, the tension, and everything that didn't serve you today. Just let it go on the exhale. Take another deep breath in and let go of everything that does not serve you. And just join us again in the room and be present and grounded. And thank you for taking that opportunity to do that with us and to be grounded. And today we have Dr. Saloni Sura. She's been here before and she's here again. And Dr. Sura is a published author of her first children's book, Flora Investigates. And it's the case of the missing gold eggs. There is a funny chapter in the book and it is for kids 6 to 9 years old, and it helps them think big and combat gender stereotypes. Dr. Sora is also a HIV and sexual health consultant, and she has a PhD on HIV infection and drug use. She has worked with marginalized communities and is here today to discuss a different topic than the last time, because the last time did not permit us to get into the discussion of her book and details about the things that she has done. So, and most of all, we're going to discuss with Dr. Sura about birth trauma and PTSD. Dr. Sura, welcome.
Thank you. It's so lovely to be back, and I feel very honored to be back again.
Thank you. Thank you. How have you been?
It's been an interesting summer. I think it's fair to say a lot of stuff has happened, and tomorrow, actually, my first child is starting school, so it's a big day.
Wow, it will be the first day of school for your first child.
Yeah.
How does it feel letting go and placing your child's socialization into the hands of a teacher?
Exciting, nervous, some trepidation. I don't know how old they start school there, but here it's kind of 4, 5, which it seems so young. And I mean, I've got a flexi school, so they'll be doing 3 days. and one day in the nursery that does kind of, it's forest school nursery, and it's amazing and Montessori based. So that makes me feel better because I'm not quite ready to, fully let go, I think. And I think it's a lot for them when they're that young to suddenly go into that full time. But it's exciting. It's going to be a journey.
Okay. Well, thank you for sharing that.
Thank you.
So let's jump right into birth trauma. It is not something that I have heard discussed. And tell our audience, why is it important for us to have this discussion about birth trauma?
So I did have birth trauma and I needed treatment for it. And I had PTSD anyway, leading into my first birth. But increasingly, I talk to women and mothers, and it's not uncommon. In fact, I'm finding more and more women that are having it that are being kind of exposed to, obstetric trauma, things. And it's not just things not working out how you plan, probably kind of worst case scenario, and the impacts of that. For me, after my first child was born, I was incredibly unwell, and it took a very long time to get the treatment that I needed. And we all know, we know the data that if you have a traumatic birth, that it does affect bonding, it does affect your child and how you feel about them. And you're also tired anyway. What surprised me, as a senior physician, was the way it was dealt with or not dealt with, and the total kind of, the obstetricians like hands off. So I ended up being induced, which I didn't want. And my child was born on the day that I knew they were going to come. And they said, oh, look, they've lost weight. And this, this is why the induction, and, they were fully engaged. And then I ended up with a forceps and a 3rd-degree rectal tear and was totally traumatized, sobbed. My little one got taken away for a few hours because they weren't well for monitoring. And it was the worst start to motherhood for me. I was exhausted after 3 days. My body was a mess. A load of hormones and drugs meant that I just sobbed for 24 hours. And, I think the lack of support was shocking. And kind of talking about it, I remember going back at 3 months and for the checkup, and they seemed surprised that I just cried at the appointment, and being referred on to a counsellor who said to me, I don't know why you're here. And I was like, well, this has happened. And they're like, I'm really glad you are here, but you need a psychologist. And I've spoken to so many other mothers who've had really traumatic experiences, certainly locally, and obstetric services here aren't great. And that have had similar experiences where they've had the birth reviews and it's somebody reading notes, or you come out of theatre and somebody's saying to you, don't have a bath, but you're totally out of it because you've had analgesia and been in labour for a few days, and how that affects you as a woman, as a mother, how that start to motherhood affects you, and then the guilt that you have once you start to feel better. So I think it's really important to talk about it and for us as women to advocate for each other and to know what treatment and helps are out there. In my case, I had my 2nd round of EMDR for it, and it worked beautifully, and I had a very different experience with my 2nd child and birth. And I, at the beginning or prior to my 2nd pregnancy, was having nightmares about giving birth, even as a cesarean. And then I ended up having a planned cesarean. I wanted a home birth, but it was a different experience. And that was how effective the EMDR was for me in that 2nd pregnancy.
What you call it, EMDL?
EMDR. So it's called eye movement desensitization and reprocessing therapy. I've actually trained in it myself because it was so powerful for me. It was really game changing for me with my PTSD and with the birth trauma. And I tried a lot of different modalities. It's a technique that uses bilateral brain stimulation. to reprocess information and desensitize kind of thoughts and emotions and subsequent somatic symptoms. So it's an evidence-based approach for PTSD, some mental health issues, and somatic symptomology. What I find for me, it worked beautifully with getting me out of the fight or flight. And so that I could reprocess them. I can talk to you about the birth and my work bullying and not be a mess and go, well, look, that happened. It was terrible, but I managed to get my life back, and then started to make decisions afterwards. So, I felt a lot of guilt about my first child because I just wasn't present for the first 6-9 months of their life because I was just so traumatized by all that had happened. And it was an incredible shock to my motherhood journey. Like, I remember a client saying to me, her start to motherhood was the worst possible case. And I felt like this was it for me. And I'd wanted a child for a very long time. I'd waited a long time to be a mother. I was an older mother. I hadn't met the right person. And at times I thought, it wasn't going to happen.
Can you describe a little bit about what the process actually is that you do for those of us who aren't familiar with it?
Of course. So what it is you will think of the scenario, the symptoms. So for me, with my PTSD, I'm just going to give this experience. It was the mediation that I've been exposed to, and you kind of have some positive statements or negative statements of, I'm just scared, or I can't be here. And then it's bilateral brain stimulation to reprocess that. So there's a couple of different ways that you could do it. You can do eye movements. So the therapist will, I'm just trying to move back so you can see, will move their finger and get you to look at the extremes of your eye movement, but without moving your head, is one way. Or the second way is to cross your thumbs over your chest and tap whilst you're reprocessing, or shoulders. So these movements, they stimulate bilateral brain stimulation so that you can reprocess them. It's also very good then for programming. So you can work on desired states and future states and the future, so you can get desired outcomes. So it's really good for kind of affirmations. And, with me, in the second case, we were working on a negative birth, a trauma. I just cried going into that hospital, to being able to have a pleasurable birth, although it wasn't what I wanted, but a different experience and a healthy baby, and not being petrified. So it's quite simple but very effective. It's usually a course of treatment, so anything from 4 to 5, but not like a whole year's worth. It's usually a course, an hour, 90 minutes. And the reason I talk about it a lot is because it was so groundbreaking for me. It really gave me my life back. And there are so many women out there who have birth trauma. And, I remember somebody on a celebrity in the UK saying, it's like all these women, women have come back from war. But it's just perceived as, oh, well, it's birth trauma, get on with it. I fed back. So when I released my book last year, I thought, that chapter of my life is closed. And I decided to feed back to a local obstetric hospital. I'm a physician. And I said, I had 2 reviews. The first one was just a doctor the day after I gave birth reading my notes out to me, which wasn't helpful. I was trying to work out what happened and why. And the second time was much better. And I said, look, why is there not a counsellor there? Do you know what I mean? Because I've had so many other friends locally who had lost children or had a really traumatic birth, and they said the same. So there'd been somebody totally new who had said things wrong. I said, why do you not have a counsellor? Like, common things are common. You've got women who've had traumatic births. You're giving feedback. Why have you not got somebody trained in providing support? Because I know as clinicians, we're not always trained in that, and certain specialities and clinicians are better at talking to people. And the response that I got was, well, it's a funding issue. And I just was like, I'm sure in about 30 years' time, we're going to look back going, that was kind of barbaric, some of the stuff that was done and the way that communication was. And, I think with what's happened the last few years with COVID, some of that has got worse for women.
Well, I know I can speak, I'm in Canada, and I had a very traumatic birth for my second child. he was born at 28 weeks. And I went into the hospital telling them I wasn't well. And they were like, you've got indigestion, take Maalox, go home. And I'm like, I'm not leaving this hospital. There's something wrong. And I had a seizure. I died. They revived me, did an emergency C-section, and I was in a coma for 3.5 days and in ICU for 2 weeks, and in the hospital for a month. And he was in the NICU for almost 2 months. And there wasn't a single hint of any kind of, do you want to talk to somebody? Do you need any help? It was just like, hey, that happened, whatever.
Wow. I mean, that's, okay, they were working physically getting you better, but that's terrible. Do you know what I mean? You've just had a baby. It sounds like you had an older child. You've got a partner. You were separated. It's shocking. It's shocking. I'm just sitting here going, it's shocking. If somebody had walked into me in clinic like that, I'd be like, wow, poor you. And that's what it was like when I was working as a clinician. So it shocks me that obstetric services are like that, and that nobody goes, my gosh, if the mother's not right, then the child and the bonding and their future, and just that, why were you not offered EMDR or counseling or CBT or something? Do you know what I mean?
Yeah, I mean, I was very lucky. I didn't emotionally have a lot of difficulty after. Like, I guess I was really, really lucky considering everything that happened. And I had a 10-month-old baby at home at the time. So, but like I say, like, it wasn't even something that was even thought of, like, or recommended, or, ever sort of, no one even ever asked the question, like, are you okay? They, mentally. So I can certainly see what you're saying is, if somebody gets very traumatized by something like that and everything, having those resources. And when you were describing that eye movement procedure, my husband got some vestibular damage, and it was very similar what they had him do to try and retrain his brain, where you followed the finger and kept your head straight. And they didn't explain it as eloquently as you did, as far as how it gets both sides of your brain working together. Can you elaborate on that aspect a little bit?
So I'm going to be honest and say, I don't know the full ins and outs, because my medical background was HB sexual health. So I think it's, like tapping can also do it, and other things can do it. But I think it works on the processing pathways, because if you've got trauma, I think you have a maladaptive pathway, and it often gets processed and put into the wrong place of the brain. So I think by doing that, it helps you to reprocess it and desensitize. And that's exactly what happened with me. Like, I can talk to you about the birth. I can talk to you about my workplace bullying. And I was traumatized. I was stalked. I, would walk into work a different way because it was so toxic. I was having nightmares about giving birth. I knew prior to my second pregnancy that the birth trauma, I needed something. And it took me 9 months to get it. So I got pregnant and I ended up having the treatment in my third trimester, but it still worked. And I still had an entirely different birth experience, despite all the other stuff that was happening in the external environment. And, for me, that was really empowering and important, because I felt so disempowered after my eldest child was born, and I felt like silly. Like, I was like, I was a doctor and all of this stuff, but the way I was spoken to and the options that were given, it wasn't really, I feel, an informed choice a lot of times. Now, I'm not saying that's the case everywhere, but I'm just saying where I ended up for my maternity care here isn't great. It's not known to be great. And, it just wasn't really explained, and you just get scared. And certainly I didn't parent as I wanted to for those first 6 to 9 months. And, there was a lot of guilt around that, of whether that had or would negatively affect my child. That wasn't what I wanted. And like I said, I wanted to be a mother for a long time. I'd waited a very long time. And it was something that I thought may not happen, as a lot of women nowadays think. So there can be a lot of expectations on that. And then also I had the rectal tear, which in itself, I had stitches down there. It's not the same. My pelvic floor was damaged. It's not, it's not the same. And, that does affect your, how you feel about yourself as a woman,
it must have been very hard as well on your partner when you're traumatized like this, both physically, mentally, emotionally, and trying to kind of find your way, but you've also got a child and a partner that you're trying to, navigate through the situation as well.
Yes, I mean, with my first, COVID hit at about 3 months. So that obviously did have a negative impact. And, we were all, I think you're just shocked. I mean, when you have your first child, it is such a life-changing thing. And nothing prepares you despite being prepared. When you have the second, you kind of know what you're doing, or do you know what I mean? It's that kind of, you're a bit firmer. So I think we were both probably a bit shocked. I remember being in theatre and they were doing the forceps and just looking at him, his eyes welled up. And I was like, why is he upset? And I obviously didn't realise at the time that they were doing forceps. And I'd had analgesia, I don't take a lot of medication, so I was pretty knocked out. And, if you're a man and you've never seen forceps, I mean, they're pretty horrific to look at, let's be honest with you. And I think he says, my husband's Italian, that they don't use it in Italy. But yeah, I remember him crying. That was my overriding recollection of the birth, was he's just sitting there crying.
Dr. Sura, let's say there's a woman or a mother who has given birth, experienced rectal tear, experienced birth trauma, but like Mitzi, is not exposed to counseling.
Yeah.
Might be having signs and symptoms of PTSD and is unaware of it. What encouragement and advice can you give to that person?
So there is help out there, and that's why I talk about the EMDR so much. I mean, there are other things. There's compassion-based CBT, which I had a bit of at the end, but I knew I needed the EMDR to process the trauma to get me to the place where I could be compassionate with myself. So I think there is help, and I think, to push for it if it's available on your health system, if you have insurance and you're able to get EMDR through there or some kind of support, do it. And, I mean, I was lucky I did get treatment for it. I had to fight for it. But, there is also the option of paying. And if that gives you a totally different experience, and, it's not like it's a year-long treatment, it tends to be a short course, so like 4, 5, 6 sessions. And, I think it's worth the investment if you get that freedom and are able to reprogram and let the past go and reprocess it and see it differently, which is why I'm passionate about talking about it.
Thank you. Thank you for sharing that. And if I heard you correct, even if they might not have EMDR in their country or wherever they are, but any form of brief therapy can be of assistance.
Well, I mean, everyone's different, so that there is EMDR, there is CBT. A lot of these can also be done online too. So I think it's ask and push and see. And if we don't push as women for other women and give feedback and say that wasn't okay, then nothing changes. So I debated feeding back some of the stuff that I fed back because I had a couple of issues with the clinicians and the way I was spoken to. But I thought, you know what? No, I'm going to, because if I was spoken that manner, then somebody else has been spoken to in that manner. And I've got a lot of medical knowledge, and it upset me, and I left a consultation sobbing, with the way that I was spoken to. So, I think it is to speak up. When I fed back, I said, look, I think this individual could do with going for some communication skills. Now, they didn't do that and whatever. But, if we don't feed back and if we don't push, then nothing changes.
How can you encourage women to advocate for themselves?
Good question. I'm going to say it's tricky, because like I say, when you're pregnant, maybe your first child, you may be going to consultations on your own. It can be a tricky environment to navigate, and you can be given a lot of jargon, and it's very guideline driven. And, we don't all fit in a box, let's be honest with you. I regret not pushing more earlier, and that was just where my situation was, and saying, no, I don't want this. I didn't realize at that time that I could say, I'm not having this, I don't want this. I thought, well, you just do what you're told. Second time I pushed and said, no, I'm not doing this and I'm not doing that. I think mothering groups or pregnancy groups are really important, or NCT groups. I also got a doula with my second pregnancy because I just felt like I needed that level of support. There are a lot of doulas out there, and certainly here I know that some do support low level, women that are not able to afford it. So they do have kind of affordable rates or different rates for different people. So there are different avenues and opportunities available. I mean, I think it is connection and community. So finding those groups, the pregnancy groups and the mum groups. I did a hypnobirthing first time. So it wasn't like I went in quiet, but I probably should have utilized that a bit more. And the person who did the hypnobirthing, actually, had I probably spoken to a bit more, would have been a bit more of a support for me to be an advocate for myself. I think sometimes getting somebody to come to you to an appointment with you is such a powerful thing. So certainly my second pregnancy, I was so traumatized at the beginning that my husband did come to the appointments. He did come to the debrief. And then my EMDR kicked in and I was like, actually, I'm okay to go on my own and I'm in my power and I'm not having this done, I'm not having this done, and I'm not being induced and I'm not having this. I was much clearer about, no, that's not happening.
You mentioned hypno. What was that?
It's called hypnobirthing. So it's kind of form of hypnotherapy that's done pregnancy. And I did that with my first, where you kind of plan, they have meditations. There's a few different types. I think Catherine Greaves is one of them. So they have meditations. They help you with your birth plan, with kind of planning the pregnancy, with kind of approaching it a different way. It's not just, planning, it's also if something goes wrong that you're a bit more adaptable. So that was a really lovely thing to do, actually. And, we did the meditations and we did all of that the first time. I didn't do it the second time because I just felt that I'd done that. But that certainly is a level of support. And there are, I don't know whether you have them there, NCT groups, which are kind of antenatal and pregnancy support groups and breastfeeding groups and things. So there are, usually hospitals or antenatal care will have some of these groups there. Some are paid and some, are affordable or free through the hospital.
Well, I just learned something new. I've never heard of hypnobirthing.
Okay.
Have you, Mitzi?
I have heard of it. I didn't know the correct terminology for it, but I have heard of people using hypnosis kind of tied in with the birthing process to help lessen the pain and things like that by sort of using your mind control. And you mentioned CBT, which is cognitive behavior therapy, just in case some of our listeners, viewers aren't sure what CBT is. And that is also a form of sort of helping to reprogram your brain from trauma or something like that as well, similar to the eye movement therapy that you're mentioning.
Yeah, I have less experience with that. Yes, but it is. Yes, it's one of the other, that was one of the modalities that they offered me. Yeah.
Yeah, and you bring up a great point, both of you too, about the whole.
You're muted, Missy.
Oh, sorry, I had my hand on unmuting, but I guess it wasn't pressing hard enough. the part about advocating for yourself, like it's so critical. Like when I went in with my second child, like I say, like they were just like, you know what, you've got indigestion, it's no big deal, take some Alex, go home. And had I not insisted in staying in the hospital, we both would have died, because like unequivocally, as it was, we barely made it and we were right in the hospital. But had I listened to them and gone home, there is absolutely no question that we both would have died. So, you have to, like you say, use that inner voice and just fight for yourself. And like you say, a great thing is to have somebody else there who can also be an advocate for you, because there's so much going on that sometimes you, like myself, I lost the ability to advocate for myself when I died. So, somebody else had to
Hello?
It's just like you say, it's just so important to listen to your own inner feeling, right? The same like as a mother does with her kids, right? Mothers, often you'll see parents take their kids into the doctor, and you feel like the doctor isn't listening. And yes, they're medically trained, and yes, they know things, but there is that inner connection between you and yourself and you and your child that no one else can really understand.
I mean, there's also it's a funny thing as a clinician, as a doctor, there's also like an eyeball thing. So certainly from my point of view, I would just look at people and go, they're not right. I don't quite know what's going on there, but I know that's not right. Do you know what I mean? Now, I know not every clinician or healthcare provider is like that, and that can be challenging because sometimes you're like, I'm not quite sure what's going on here, and that can be uncomfortable to sit on. But there were certainly I was one of those where I'd be like, okay, somebody's telling me this, or standing back and going, what's going on? It can be harder to find.
Other than the EMD and maybe the CBT, what would you attribute to overcoming the PTSD, and how long did that affect you?
So I had PTSD for a couple of years before it was diagnosed. My sadness was that it wasn't diagnosed, and I saw occupational health, medical health services, quite a few psychiatrists. I was functioning, but I was incredibly unwell. And, in hindsight, it was really clear. Like, I moved country when I was 6-7 months pregnant because I didn't feel safe. I mean, that was really clear. The cynic in me will say it's because I was a clinician who was looking at other avenues because of what happened with the work bullying. So I had that for a couple of years. My perception as a physician was that people with PTSD were army veterans who had gone to war and came back and had these shocking flashbacks. And that wasn't the case for me. I was petrified and in fight or flight the whole time. And that worsened. I ended up being stalked, and somebody sent anonymous letters about me to various different people, and they knew a lot of information about me, and I think that really did push me to move. All that seemed to happen was people wanted to put me on antidepressants, and they just made me very drowsy and sleepy. And I remember going to the profit psychiatry in one of the maternity hospitals and saying, I don't want to feel like this. I was going for counselling, I was doing my own tapping, I was going for yoga, I was doing Reiki, I'd gone to sound healing, I'd gone for kinesiology, acupuncture, reflexology. Like, I was trying everything. But I don't want to feel like this. Send me to a psychologist. There must be something that can transform this. And I didn't know about EMDR, and I didn't know I had PTSD, but I knew there was a reason I was feeling this. I had this work bullying, had this terrible mediation. And I was like, there must be something that can transform this because something has happened. Surely I don't want it to define the rest of my life. Now, I was told that no, I was pregnant. I think they didn't have it anyway on site. It was a huge sadness that wasn't done. So I think, I was a clinician, senior clinician. I didn't know that much about PTSD. So I think knowledge about it is low in healthcare circles and treatment, and it's one of the other reasons why I talk about this a lot, is to get awareness out. And it's one of the reasons why I trained in it. So, it was offered locally, and I thought, I'm going to do this. Wasn't sure what I was going to do with it, but it was so powerful for me to get my life back because I'd done all these modalities and I was functioning, but I wasn't free. It was running me, and I was fight or flight. And it wasn't until I had this that I started to put weight on. I mean, I hit 7 stone after my first child was born. I mean, I always get thin anyway. I'm thin anyway, and then with the breastfeeding, I get thinner. But that, that wasn't healthy. And I remember just looking at my eldest child and crying because I felt guilty because I desperately wanted them, but I knew this wasn't the way I wanted to parent. And I wanted to feel better. So after that, I started to make plans for the future, and I started parenting as I wanted, and I was putting weight on and started to feel better. And then I actually I do want another child, and I don't want this to be my only experience of pregnancy and childbirth, So it really gave me my life back. I did other stuff afterwards, but this for me was pivotal in getting me out of the fight or flight and reprocessing it so I can talk about it. And so I'm not still living those memories. These terrible things happened to me. It's terrible, it's wrong, but I have moved on.
Yeah, I think you brought up a really good point too, which is, when I think of PTSD, the first thing that jumps into my mind as well is somebody who's gone to war and seen horrific things, and you that's sort of what I always in my mind, I guess, associated PTSD. But there are so many other things that can cause PTSD for people. And like you said, when you realize you're in that constant fight or flight and you're surviving but not thriving, and you're stuck but you can't figure out how to get unstuck. Like, I think that those are signs that there can be some of that PTSD, and to, if somebody's experienced those types of things, to start looking and trying different modalities, because as you mentioned, everybody's different. And for one person, for me, many years ago, I had a car accident and tried many different things. I could not break the pain cycle. And finally, acupuncture was able to break that pain cycle, whereas for, someone else, it was some other different treatment. So, but exploring and not being afraid to try things and to give them an opportunity. As you mentioned, it can often take, 3 to 6 treatments. It's not like you snap your fingers and it's going to be fixed. It's a process.
Yeah, absolutely. I mean, so I'm going to open up my coaching work. I'm offer EMDR therapy, and it'll be like a 5 package. So in my coaching before, I used to just like 1 or 2 sessions, but now, I need people to commit, and that's what they were saying in the training. You need 4 to 5 sessions to, commitment, because it takes time. Like you say, it doesn't go overnight, and it's a process. And sometimes it can get a bit worse before it gets better, because you are reprocessing that, and it can bring up, you start to remember a little bit more as you're going through it. But I think it's powerful. It gave me my life back, and that's the only way I can describe it. And I speak to so many people. I was doing a belief coding session with a lady the other day, and they use bilateral based stimulation for it, by the way. And she said, it was a game changer for me. She had EMDR. But the beauty with it is you can also use it for programming and affirmations. So that's, you've got the trauma to treat the trauma, but that's also what you can use it for. So, I tend to work a lot with people who have sexual trauma, because I'm HIV sexual health consultant. I worked as a rape examiner for a bit. I've had lots of clients as a doctor that were sexually abused. And I tend to find with my coaching work, I tend to attract women who are coaches or therapists who have been sexually abused or have sexual assault or trauma, and often they're functioning really well, but they've still got this part of their lives where it's sitting there. So I tend to find that for me also intergenerational trauma, which is also very similar to bullying, because obviously I've been bullied, but I tend to attract people when you've had bullying issues and ghosting and gaslighting. And then financial trauma can also, you can get elements of PTSD because it's so empowered and it can really dictate our lives. So I have trained as a tapping into wealth coach, but I'm really looking forward to embedding this in more and utilizing this with the financial trauma and on the money side of things as well.
Wow. Thank you for raising about financial trauma, because I'm sure a lot of us don't think about that, financial trauma, which leads to poverty, can be an intergenerational trauma that a lot of women might be facing. And it never dawned on me to highlight the lack of finances or the lack of meeting your basic needs according to Maslow can lead to trauma. It's like you just set off an alarm in my head, because it is such a norm, And when things are normalized, you fail to see the consequences and the impact that it has on individuals. So thank you for raising that. I have not thought of the financial trauma.
You're welcome. I mean, it's been a big part of my life. So, I grew up with Know Your Place, Little Girl, and money was used to control. And it's fight or flight. And it's, I've recreated that. But that was passed down. And, that's not going on to my children. The same with sexual trauma. You can see often with parents that have experienced sexual trauma that their children's response to sex and sexuality and healthy sexual relationships is abnormal and skewed because they've grown up in a household where a parent has experienced sexual trauma, so they may have been sexually abused, they may have been raped, and that skews things and that passes down and determines relationships.
Mm-hmm. Mm-hmm. And as you mentioned, the skills that you develop when you go through this process, you can break the trauma, but then you can also use it for building the future with the affirmations and, taking yourself. It's almost like you keep hitting yourself on the ceiling, and it gives you the ability to raise the roof and to flourish and thrive and fly and be able to tackle new things.
Yeah, so desired outcome. I mean, it's not obviously you've got to go and do the work, and that it will lead you to other things and push boundaries. But I think, if you get the freedom from that trauma and the fight or flight, because so much, when you're in trauma, fight or flight, so much of your energy and life force and brilliance is in that trauma and fight or flight. And then, you've obviously got the physical impacts of the adrenal overdrive, the tiredness, the hormonal imbalance, the gut digestion issues, chest issues, heart issues, infections, just the immune system. That if you're not running around with that all the time, then your body's functioning better, your mind is better, you're feeling better, you've got more energy and brilliance, you're sleeping better to do other things.
Oh my word. Dr. Sura, you just raised something, because oftentimes when sexual trauma goes untreated, and the body's in constant fight or flight, the digestive problems, that's so common, but I am sure a lot of women are not aware that that is attached to the untreated sexual trauma. And there's so many other physical ailments that we experience that is directly linked to fight, flight, freeze. The body's in that mode and it is affecting our health. Thank you for raising that. Please, can you just highlight that a little more?
Of course. So let me talk about me. When I was at my worst, I lost a lot of weight. My periods were irregular. I went, I used to be out trying things on meetups. I went, socially isolated. I in work, I lost my voice, but even socially, because what do you say to your friends? How do you explain what's happening in your life? I felt hugely ashamed. I was eating a banana a day. I was having profuse diarrhea, but my digestion, I thought it was irritable bowel. It wasn't. It was just stress. The big thing for me was I got chest pain. So that was what really made me go off. Like I physically had chest pain. I think it was just everything. I think it was just my heart was hurting from all the horrible stuff that had been done, and from trying to get help and trying to come up with solutions and just being told that I was imagining it. So I had the full-on ghosting and the gaslighting, which is hugely upsetting. And what else? Sleep. Broken. So I was probably sleeping 2 to 3 hours a day, broken sleep at best. It was incredible that I was functioning. And when I look back, that had been going on for quite a while. But because I was working part-time, because I was coaching, because I was doing tapping and yoga and all this other stuff, I functioned for a few years with it. Which isn't a good thing.
Mm-hmm. Wow. Mitzi?
I was just going to say, you really brought out how the trauma can manifest itself in many different ways. And for people, a lot of times they're having a lot of issues that they can't just kind of figure out. And a lot of them have probably never sort of thought to kind of do a deep dive and say, is there some kind of a trauma that has happened in my life that is, affecting me physically, mentally, emotionally, that I didn't realize. And I would venture to guess that a lot of times there is some underlying trauma that is there. And when you start to deal with that and resolve it, then you can start to deal with all those other health issues. And a lot of them may just go away on their own, because it's that, like you say, the body's not meant to be in fight or flight 24/7. And so when the body gets put into fight or flight 24/7, it can keep going and you keep functioning, but you're just, you're holding on to the rope as you're hanging, but that's all you're doing. You can't thrive. You're just hanging on.
Yes, and at some point you'll hit a crisis and you just can't do it anymore, and that's what's happened to me. And, for example, I used to do like kind of reformative Pilates, and I've always liked quieter yoga, but when things were bad, I couldn't do the reformative Pilates. I had to do slow Pilates and slower yoga. So I was onto the restorative yoga and the yin yoga because I just couldn't physically do it. Like I could feel my adrenals pumping. Do you know what I mean? That there were certain things I just couldn't do. My body just needed calming down, because it'd been so overdriven for so long, just expecting to be attacked, feeling unsafe, having been attacked, still living in that fear, and then the gaslighting of, you made this up, you've imagined it, it's you. And it's so damaging, the gaslighting. Somebody did it to me recently, and I was able to step back and go, this is what it was, but like, how do you deal with that? For me, the only way I can deal with it is by cutting those people out, because you're never going to win. Do you know what I mean? You're never going to win with somebody who's doing that to you. There is no winning. The only way is removing yourself. And sometimes that can be very challenging, because it can be people who are very close to you.
Could you just elaborate again, because there may be some of our listeners, viewers, that don't really know what gaslighting is, because I think it's a really important thing to talk about, because I think it happens to a lot of people and they don't even realize that it's happening. So could you just elaborate on that a little bit?
Yeah, so I don't know if anyone's seen the film, but it's like making somebody believe something that's not true, and being so convincing that they're making you doubt yourself. So, for example, my work bullying, I kept being told, well, maybe it's you. Like, people talk to me like I was the one doing the bullying, or, is it a personality issue between you? The other individual, not moved on, had issues in previous workplaces. Do you know what I mean? There's usually a pattern. Recently, for me, I had an interaction with somebody where they had done something that was really upsetting. You could say it was ghosting. And, I was talking to them about it, and they said, well, I've apologized. And I was like, but you haven't. I've apologized. When are you going to put the past behind you and move on? And I was like, okay. And I was speechless, because what can you say? And then I thought about it afterwards, and I was like, why? I just can't win with this person. I was like, but they haven't. They ghosted me. And then they gaslit me because they told me they'd apologize, and they hadn't. And then they made me feel like I was crazy, and that I was being unreasonable, and that I should move on. And, it was actually deeply upsetting for me. And I kind of stood back and went, oh God, this is like proper gaslighting. No wonder I found it so traumatic in the past. And the only way I can deal with it, and if somebody else has got another approach, that's great, was just to go, I actually can't interact with this person because I'm not going to win. And for me, at multiple points, it was the same people gaslighting me, going, well, if you had a family, it wouldn't matter to you so much that you were being bullied. Sorry, what? Or you can't make somebody change their behavior. Yes, but you can make them take responsibility for their behavior on others. You can make them understand it's not okay to take stuff out on others. So gaslighting, going back, is telling somebody they're imagining it, that they're making up, and making them believe something that's not true, like trying to convince themselves that they're going crazy. And the only example that I can really give you is that person saying to me that they had apologized when they hadn't, and to move on.
It happens a lot in abusive relationships too, right? Like, one of the main things that the abuser does, which is they, say for example, a cheating spouse or something like that, right? Like they're like, no, it's not happening. You're imagining it. Meanwhile, they know for sure that they are doing that, but they're making the other person feel like they're crazy for thinking that, from what I've sort of, right? So that sort of, that cycle of, somebody who knows what they're telling you is in fact a lie, but they're making it seem to you and to everyone else that you're the one that has the issues and is having the problem. And then the person starts to self-doubt themselves, like, because I did a lot of work with abused women and stuff, and that seemed to be a very common thing that happened to a lot of them, that type of gaslighting.
I think it's very common. It was very common in my work situation. I go to people saying, look, we've got a problem, we need to resolve this, let's get a psychologist in, let's get that. Like they talk to me like I was the one doing, the bad behavior, and, no, or let's just move on. Or, somebody said to me once, well, I'm not going to make notes because I don't want to take sides. And I was like, there's no sides in this. This is what's happened. So yes, you're right. It's really common in abusive relationships. But I think it's really come full stop. So if you're in a work bullying situation, I'm sure there's a fair bit of gaslighting going on. And if you're in a traumatic family that are, there's bullying in the family or intergenerational trauma, well, there'll be a load of gaslighting there too. That's just the way it is. Do you know what I mean? Or I've said sorry. I'm sorry, no, you haven't. I think it's more common. It's more accepted in the domestic violence situation, but probably much more prevalent than we realise.
Well, I don't have any more questions, Dr. Sura. There were so many aha moments here, and I'm sure our listeners are going to say the same thing. It's funny that I never thought of financial trauma the way that that you actually defined it. Usually when we talk financial trauma, we are referring to financial abuse as a form of domestic violence, but not the trauma of poverty. So thank you so much, and thank you for your time. In closing, what would you like to leave with us?
There's hope. You can break free. There are treatments. There is CBT. There is EMDR. And, certainly the EMDR, you don't have to have PTSD. It will work on trauma, and it will work on kind of some of these maladaptive.
Thank you so much for joining us today on Transforming Lives Panel Podcast. We hope that you received some nuggets of wisdom and seeds to plant along your journey of transformation. If you enjoyed what you heard today, we encourage you to let us know and to share us with those that matter in your life. If you would like to connect with anyone from the panel or our guest speaker, you can find all of the ways to connect in our show notes. We have so much gratitude for you, and we are so thankful to be a part of your day. Until next time, take great care.